year began, I feel like the world has been in catch-up mode, catching up with COVID. I mean, it's been 6 months and we're still playing catch-up. In Kenya alone, in the month of June, as community spread of COVID-19 has taken root, we have had so many cases come up just in this month of June. And we have had to play catch-up with how the health system responds to ensure that each and every patient who does need some care gets the best health care possible, but also has a good outcome. So when you hear the term home-based isolation and care, it's like a prescription really. You cannot sit at home and suspect you have COVID and then go into isolation and care. No. You are typically discharged from the hospital with a prescription. So just the way a prescription would read, take this drug for this number of days, this number of times in a day, and then come back and see the doctor on a particular date. That prescription says home-based isolation care for X number of days. And the prescription is different from a normal prescription in that it has treatment for you, but treatment for your family. So let's look at what that prescription would say, specifically for you, the patient. The first thing on that prescription for you is to stay home. Remember, you're still infective. You can infect other people. You can infect members of your family. You can infect the community. So please, this is not the time to have your friends visit, have your family friends who you haven't seen in a while come and visit. No, stay home, and preferably in a room that's designated for you. Secondly, on that prescription is you have to take personal responsibility to make sure that you're not infecting the other people in your house. Avoid infecting them. They're the usual measures. Wash your hands, social distance for as much as possible, stay in the room that's designated for you. But if you have to leave that room and still be within the compound, you must wear a mask. Remember, you are the source of the infection through droplets coming to your hands, and then you touch things. If at the worst case scenario, there was one mask in the house, you are the one to wear the mask. Third on your prescription is about monitoring. Why do we monitor? Because when you do get the COVID-19 disease, we do not know which path you will take. At the very beginning, most people are asymptomatic, and then that path kind of forks into two. There are those who go through the disease and right through it to the end, you just have very mild symptoms or no symptoms at all, you're fine. But then there's the other group. You start off without symptoms, you start off okay, and then as the disease progresses, you get very sick. You have very severe symptoms, fever, cough, difficulty in breathing, shortness of breath, up to and leading to death. So at the beginning of this illness, we do not know which path you will take. That's the reason why you need to monitor, and that's why monitoring is on that prescription. Now, what do you need to monitor? So on a daily basis, you need to monitor your symptoms. So a thermometer in the house, with which you take temperature and record a daily temperature, as well as cough, difficulty in breathing, shortness of breath, that have to be recorded. So 14 days from when you are found to be eligible for home-based care, you have to keep this record. This prescription part, the monitoring, also goes for your family. So let's look at what's on that prescription for your family. So remember, the goal for your family really is to keep COVID free. Even if they're taking care of you, the goal is to remain and keep COVID free. Now, in keeping COVID free, you have to have a designated caregiver. So not everybody interacts with you in the house. You will have that one person, the same person every day. Secondly, there needs to be an infection prevention system that's set around your personal things or the things that you use. These are your beddings, your utensils, and for these things, I think the easiest way to put it is Think of like when you have a baby, when you have a new baby, a newborn in the house, and you set up their bottles, their dishes, they are washed separately, their nappies, the baby clothes, they are washed separately. So you set up a system like that just for the COVID patient. This is the role of the caregiver, to set up a system like that, so that the clothes, the dishes, and anything else that the person uses is washed separately from the rest of the family. Soap and water will do, that's okay, and then you hang them out in the sun to dry. The third thing on that prescription that is for your family is to think about infection prevention through inanimate objects. By this I mean things that you touch commonly. For example, if you're watching TV, I use a remote control, I give it to you, I pass it on the next person. Doorknobs, we all touch the doorknobs. So such inanimate objects that are of common use in the family should be disinfected at least once a day. And in terms of disinfection, people usually ask, how will I mix the disinfection solution? Jik will do, and this is how you mix Jik. Jik, it's 3.5% concentration of the sodium hypochlorite. So how you do it, you take that Jik, whatever measure you use. If you use a bottle, you use a bottle for the Jik and the water. If you use a cup, you use a cup, the same cup for the Jik and the water. And what you need to do, you need to get 1 cup of Jik and 6 cups of water and mix them in a container, and that's what you use to disinfect. Wipe down the surfaces, you wipe down the doorknobs, common areas, just to make sure that you're also not picking up COVID from all these inanimate objects around the home. So I hope that quick brief of thinking through home-based isolation and care as a prescription for you at home has helped you think about a few things that you need to expect and that your family will expect. Lastly, let me address patients for whom symptoms develop. For you, you need to contact your healthcare worker or a health facility near you and say and seek help, because with COVID, what we're seeing even here in Kenya is that things can get serious and go out of hand very quickly. So please do not stay at home and assume that you'll be well. If you do need urgent help, don't forget you always have *719# for questions, information, and guidance on COVID. Here at HealthCode, we always seek to guide you to navigate the choices that you have to make in regard to health in that last mile, which is your home. And in making the choices that you do, we ensure that whatever solution you get is simple, it's practical, and it's sustainable.